Hi, everybody. It's me, Fran Drescher, the founder and visionary of the Cancer Schmenza movement. And we're bringing you a new series called Corona Care for You, where I'll be interviewing some of our most esteemed associates, medical advisory board members. And right now, we're actually very lucky to be interviewing one of my doctors that I really admire and respect, who is the founder of the Akasha Wellness Center here in Los Angeles and Santa Monica. And he's an integrative doctor who embraces functional medicine and combines Eastern and Western wisdom. And I want to thank Dr. De Mello for being here with us today. How are you?
I'm well, thank you, Fran. It's a pleasure to be here with you and your audience and to share with them my experience with COVID and what I can do to help us deal with what I hope is not going to be the new normal for all of us. So I'm happy
Now,
to be
I
here.
find it very interesting. I was really looking forward to speaking to you, I should say, because you actually are right on the front lines. You have 20 patients that have been diagnosed with the coronavirus. So I was really interested in hearing directly from you. Why do you think these people became vulnerable to getting the virus? How severe are their cases, and what specifically are you doing to try and help them recover from this?
Yeah, thank you. I actually, as of this morning, I have 23 patients.
Wow.
I know. And the silver lining
Are
is
they
that
all local, or is that around the world?
no, it's around the world. 12
Oh,
of them are in New York.
oh, I
Um,
see. Okay, that makes
yeah,
sense.
yeah, 12 of them are in New York. Three of them are overseas, and the rest are, a few of them are here in Los Angeles. There's a couple of them in the Bay Area. With telehealth, I'm able to connect with patients all over. And what I'm seeing is that people in the epicenter of this, in the hardest hit areas, are the people who I'm treating or have the highest number of patients with this that I'm helping. So
Now, let me ask you something, because, of course, New York is a densely populated area, and that's why it was so easily spread. Because, in spite of the fact that we now know that the COVID-19 is somewhat fragile as far as viruses goes, but is very easily transmitted. So therein lies the rub. I would have assumed that people that make you their physician also kind of every day pay attention to bolstering their immune system and not living a toxic lifestyle that would compromise their immune system. What is your theory on? I mean, I don't know, maybe I'm being naive. I kind of felt like if you do everything right and you live pristinely, that maybe your immune system will protect you from it.
yeah, no, I think you have a very good point. I think this virus is very unpredictable at this point, and sadly, even though the internet is saying otherwise, we know that there is no prevention and there's no cure yet. But what there is that I'm seeing across the board with my patients is those who strengthen their immune system, those who are able to do their anxiety in a different way, those who are still looking for the silver lining in whatever is happening in their lives. There's always a silver lining. Those are the people who are recovering from it at a faster speed. And,
Interesting.
and so I think that along the way, what you've been doing in your own foundation and other people around the world who are doing similar work in telling us that the answer is in your lifestyle. The answer is how we are walking the planet. The answer is how you see disease yourself. The answer is your version or your vision of yourself, of your immune system. All of this is making an tremendous impact on people's recovery.
So balance of mind, body, and spirit
Absolutely,
is important.
absolutely. And we talk about it all the time. Like, Fran, I know you've been doing this work for a number of years. We talked about the placebo effect. We talk about the power of the mind. And for those people out there who are skeptical about this, you don't have to listen to Fran or I. Go to the website and put in National Institute of Health / Integrative Medicine. And the amount of research over there talking about the connection between mind, body, and your immune system is perhaps one of the highest these days that we've ever seen. With the advance of integrative medicine, of functional medicine, of people who has an audience like yourself trying to educate all of us, it's paying off. We are now able to step back and to say, okay, maybe there's no treatment for this yet. Maybe we don't have a vaccine yet. Maybe there's not a medication, contrary to what the internet is saying. There's not a medication that can prevent this. But I know one thing, we've been here before. This is perhaps one of the most advanced diseases of our times because of the rate of which it infects people. But we've been here before with the SARS, before with other pandemics, and those people who survive are often the ones who take better care of themselves. The
Are
ones
you?
who
I'm sorry.
and the ones who don't, and what I'm seeing are the ones who have a harder time getting over their condition because it's weakening their immune system. So
Are you doing high vitamin C IVs with your patients?
yes, yes. Not necessarily at Akasha right now at my clinic because we are closed. We have been closed to follow the mandate by the state. We are doing a lot of interventions through telehealth. We are communicating, but I have a number of people in other states, and even in California, where they have the means to bring in somebody to do the IVs. And for those people, I am recommending, based on the studies coming out of China and of Italy, showing that high doses of vitamin C, IV, but also orally, are making a difference. It doesn't cure the virus, but it affects something called the cytokine storm. And the cytokine storm, as you have all heard on the internet, is when you have this amount of viruses, the viral load, all at once infecting the cells. It's the cytokine, is the transmission, the protein on top of the cells that allows for the transmission to be so rapidly from one person to the other. And a cytokine storm, when it happens, it overwhelms your system. So we need to think, okay, if I get this, what do I need to do to strengthen my immune system? So you go to research that's been around for many, many years. Linus Pauling, as we all remember, for some of us remember, won the Nobel Prize in 1970 by showing the incredible anti-inflammatory effect of vitamin C. And that is the vitamin, Nobel Prize, they're showing it. And even though more and more people out there on the other side of the camp comes out against using vitamin C as the treatment, research is showing them otherwise. And so it's not even me or you speaking. Go to the research coming out of different countries showing that it is anti-inflammatory. It does provide a level of protection to your cells. It does make immune system stronger. So why wouldn't anybody take it?
I
So
don't know why they're not giving it out, to every citizen. How many milligrams do you suggest people should start taking orally, even if they're not infected, but perhaps prophylactically?
that's a very good question. So if the person does not have any gastrointestinal issues, let's say you don't have, heartburn, you don't have GERD, you're not somebody who is dealing with a lot of inflammation in your gut with an ulcer, then I'm recommending 3,000 milligrams of vitamin C a day in 3 divided doses. You can take 1,000 in the morning, always with food, 1,000 in the afternoon, and 1,000 with dinner, and use with food to decrease the amount of acidity. Let's say you have some GERD, some acid reflux, or you're being treated for SIBO, or you have an inflamed gut, then I would recommend that you take 1,500 in 3 divided doses, 500, 500, and 500. So it depends on your profile of your healthcare profile. And
Now, it's interesting that you bring up SIBO. Why would, SIBO, having SIBO or getting over, or if you've had SIBO, be an issue with taking mega doses of vitamin C? And for all those who don't know what SIBO is, perhaps you can just tell us what that's an acronym for.
Okay, so SIBO it stands for small intestinal, so SI, small intestinal, bacterial, that's the B, overgrowth, that's the O. So SIBO, small intestinal bacterial overgrowth. And this is something that now we know is the cause of many, many gastrointestinal conditions, such as your IBS, such as leaky gut. We now know that SIBO is the dysbiosis, meaning the unbalanced bacteria in your gut. So when you have an imbalance between good and bad bacteria, what you end up with is SIBO, and that can have the face of the small intestinal bacterial overgrowth can show up as inflammatory bowel disease, leaky gut. But the treatment for all those conditions is the same. It's to basically help your body realign the gut lining with good probiotics, with good bacteria, work on your diet, sometimes use some herbs to be able to bring your gut back to balance. So why is that important? Well, for two reasons. One is because those with gastrointestinal conditions are at a higher risk for the SIBO, for the COVID, because as we know, the gut is your second brain. The gut is your carburetor. I refer to it as the carburetor.
Gut is immune.
It's the foundation of your immune system. And so if the immune system, a great percentage of it arises from your gut, then one way to strengthen your body against any bacteria infection, any viral infection, COVID or otherwise, is to strengthen your immune system. Vitamin C is part of the protocol for SIBO, but it's mostly IV because we bypass the gut. When you give somebody IV through your vein, you are getting the IV right into the cells by bypassing the gut, because vitamin C is very acidic. And so you have to be careful if you have a gastrointestinal condition that the vitamin C is not increasing acidity when we're trying to keep your body alkaline.
I see.
So that's why.
Okay, that's fascinating and definitely good to know. How being an integrative doctor, how would you say that your protocol may differ from more traditional Western medical institutions in treating COVID patients?
That's another excellent question. So I am a big advocate for your traditional medicine. Traditional medicine saved the world. Penicillin saved the world. When I send patients to different labs, that's traditional medicine. When I send people to have an X-ray or an ultrasound, that's traditional medicine. So Western medicine, traditional medicine, is an incredible medicine with a lot of diagnostic tools, but it doesn't say anything about prevention. It's a medicine that works very well when you have symptoms, when you get sick. And whereas integrative medicine and functional medicine is talking about, let's prevent you from getting sick before you get sick. The difference is no different than why, for those of us who live in Los Angeles and have to drive everywhere, why do we take our cars in to have our scheduled service? It's so that we don't get stuck in the freeway, broken down.
Right.
So you do this so that you don't get sick. Well, that's integrative medicine. It says to the patient, what can we do today to optimize your health, to optimize the memory that your body has of good health? All your cells have memories of what it is to feel good, to feel healthy. What can we do today to strengthen it so that if you happen to get sick, you can ride the wave a little bit differently? Here is the difference. That is the difference between allopathic medicine versus integrative medicine, functional medicine. One treats the symptoms, the other treats treats the cause, and it prevents the cause from overwhelming the system. So when we find a cause, we go and treat it. Um, what I'm seeing, the difference out there in the world, is that for those of us in integrative medicine movement, we're telling people right now, strengthen your immune system. In addition to the physical distancing that we're talking about, later on, remind me to explain why I refer to it as physical distancing versus social distancing. Um, but so, in addition to the physical distancing, what we're telling people to do is look, based on research, this is what we know about this virus. We know that the virus can be fought better if your immune system is strong, if you're taking vitamin C, if you're taking vitamin D. There's an Italian study that came out with vitamin D giving people high dose of vitamin D so that they can be optimal in their numbers is helping people recover from this faster, right? We know that the sunlight, that this virus is very sensitive to heat, and it dies at a temperature of 56 degrees centigrade, which is roughly about 130, 132 Fahrenheit. So we know that by asking people to socially distance, but to still spend some time in the sun, we know that's being helpful. And some of my patients who are lucky enough to have infrared saunas in their home or any kinds of sauna, or sometimes even having what I refer to as the infrared blanket that you buy on the internet. Those people, those 23 people who had it, and the ones who were able to have infrared sauna exposure to use it, they recovered better
I
because
have a biomat. Is that fall into that category?
biomed doesn't fall into the category because you're not covering yourself completely, but it does increase heat in your body.
I
And
see.
so I recommend for those people who have biomats to use it at the highest temperature without burning themselves because the virus doesn't like heat. And that's one of the things we are hoping for with the physical distancing that people's in the southern hemisphere or even in the United States where the climate is a bit hotter, that the spread of the virus is not going to be as fast and it's been in other parts of the world of the country. You're hoping for that. So that's the difference to answer your question. What we do as integrative doctors, we're telling people, yeah, it's true. There's no cure so far, other than we're waiting to the vaccine. Yes, if you get sick and very severely sick, you need to go into the hospital. That's all true. But what they're not saying is, what can you do at home today to strengthen your body against this disease? And that is to do some of the things that I'm saying, to stay positive as much as we can, right? To see the silver lining. Somebody
What
recently
are,
told me,
what are your thoughts on propolis? Do you?
propolis. Yeah, I love propolis,
Oh,
and I use it all the time.
oh,
I
great.
yeah, I don't think that there's been, as to my knowledge, Fran, there's been no research on propolis for COVID-19, but I personally have used it a lot with
Do you
other viruses.
spray it in your throat or do you drink it?
I use the drop, so I would put on the top of my either below, underneath my tongue, or sometimes I would spray in my tongue as well, in the back of my throat, and swallow it. So sometimes people have the tincture without the spray, and the tincture is as good. You put underneath your tongue, and then you gargle with it, and then swallow it.
Okay, but I interrupted you before when I asked you about the propolis. Were you about to say something and I interjected and threw you off, or?
No, no problem. We
Okay.
love that we're having this back and forth. No, I was saying to really make sure that you find a practitioner that you trust, a practitioner that you believe in their approach, and through telehealth, follow their advice. Because what most of us are doing, as you know this, being in the healthcare movement, Fran, is that we are going to the internet and we are reading information that is just not valid, and
Right.
that's just confusing the midfield so much. So if you must read it, read the ECDC, the European Union CDC. It's called ecdc.org. Read the World Health Organization. They recently launched an amazing website called Infodemic. Go and read what people are saying. There's another website, an English website called Our World in Data. Our World in Data is a great website where you'll see what's happening scientifically evidenced in the world. Read the CDC, but avoid news that are just not scientifically evidenced because it's confusing you, it's confusing practitioners. It's making a lot of this unnecessarily harder than it needs to be.
Now, I think that we're probably both believers that food is medicine. And could you give our viewers some tips on how they should be eating and what they should be eating to support their immune system and systemic health?
Yes, yes. Oops, sorry, my earpiece dropped. Oops, there you go. We're back. Um, so that's a very good question. Again, I think the idea here is to make sure that you're avoiding added sugar at all cost, right? And I know it's hard for some of us. We're home. We want to bake. We want to have some good dessert. Find the healthy desserts for you to make in the internet. Find things that you can do that doesn't require a lot of added sugar. Why is that? Well, it's an organism. We are organism. COVID is an organism and human beings are organism. We like sugar, so do they. So, right? If you have an experiment in medicine, in microbiology, where you need to replicate a virus or a bacteria, so you use a little petri dish and you get a little bit of the virus in there. And what do you use to make the virus grow? There you go. You use sugar to make the virus grow, to get the bacteria grow. So first and foremost, avoid sugar, added sugar. If you must go for the sugar, so like I do sometimes, I have the sugar that I want to get when I'm sitting down after a day of work. Go to your fruit, find your favorite fruit. Is it a sliced apple? Is it a sliced orange? And then if you must have your ice cream, some of us will have the ice cream no matter what. Try to see, okay, can I add some good thing with this ice cream? Can I use 1 scoop of the ice cream? First of all, can I use ice cream with less sugar? Maybe with coconut base, less dairy? And can I add something? So the other night, my son was wanting us to, I have an 11-year-old son as well, and he was trying to get all of us to watch his favorite movie, and he wanted us to have ice cream. And when your 11-year-old son, who's being hunkered down for weeks on end, says, can you watch this movie with me, please, Dad? You're always on the phone. You're always talking to people. So you have to listen. So when I sat down with him, I thought, okay, what can I add to this ice cream to actually help me, help him, and also for me to feel less guilty? So I went out and I bought pineapple. and we sliced a pineapple and we added pineapple to the ice cream. Why pineapple? It's a very rich source of quercetin, which is an inflammatory incredible compound that has been used all over.
I didn't know that, and I love quercetin. I
Yeah,
often take it as an, anti-inflammatory. So
yeah,
that's wonderful to know.
yeah. So there you go. You can do that with orange. You can, do a dessert with fresh orange because one sliced orange will have about 80 milligrams of vitamin C. I mean, that's not bad,
No,
right?
where do you stand on animal protein, meats and things?
I mean, if you're gonna eat animal protein, I'm not against it. I'm personally, I'm a pescatarian, so I don't eat meat. And when I eat meat, it's fish, usually fish, once or twice a week. And I believe that your body knows what it needs, not your mind. If you think, oh, I need to have red meat or chicken, whatever meat, because I want to, ask yourself, do I want to because my mind is trained towards that? Or am I listening to the needs of my body? Your body has an intelligence. And some people need that. And if they need that, I will say to them, have it. Have your bone broth. Bone broth is excellent, right?
But
Buy,
make sure it's organic, right?
make sure that it's organic correctly. Make your own or order one online or Whole Foods has some of it sometimes. Make a bone broth soup. And if you're gonna eat meat, make sure
Why, do
they.
you manufacture bone broth? Is that what you?
No, no,
Oh,
I don't manufacture, but I have a good patient of mine who had a medical condition, and we were able to help her through bone broth as she became so infatuated with it about 4 or 5 years ago that she now has a thriving bone broth company.
oh, wow.
Yeah, and I can send that information for you if you want. So, um, yeah, so there's several people making those bone broth. They're organic. They're infused with love. That's very important, right? For those of us who cook, that movie like Water for Chocolate is one of the most amazing movies I've ever watched because it shows the audience the power of cooking with love.
Yes.
The fact that those molecules that you're cooking, those foods are then infusing your body with love and with ways to strengthen the immune system. So ask your body what it needs, and if it says I need meat and it's not your mind, then make sure that your meat eating is followed with good protein, good vegetable source. Make sure that you're balancing your vegetables with the carb. Make sure that you're being very well hydrated. Make sure that your elimination, are you going every day? If not, what can you do to improve elimination? Because the body is all about eliminating, right? So things don't become toxic. And drink a lot of water. Drink water. Now, there's a
Now,
difference.
you once said to me, put some honey in the water and that will
Yeah,
hydrate you better on a cellular level. And
yeah,
I told everybody that.
yeah. So a lot of people, that's a very good question again, Fran. People come in and say, I feel dehydrated, but I drink a lot of water. And I explained to them that there is two compartments in your body. Well, there's several compartments, but not for the sake of water. There's two compartments. There's your extracellular component, which is your muscles, your bones, your hair, everything that needs water. And there's the intracellular component, the part of your cells that need to be fed with water as well. When you drink water, the water goes primarily into the extracellular. For it to go into the intracellular, inside your cells, it needs a pull for the cell to be able to allow the water in. And the pull is usually a little glucose. So it can be, for those of you who like emergency, those little package, it can be that. It has a little sugar in there. So I tell people to dilute, a whole liter of water with one of those. There you go. You are able to hydrate your intracellular space better. You can put a little honey in your water or tea with honey. So, and coconut water. For those of you who can drink coconut water, who like coconut water is excellent for your intracellular space.
Because it's full of electrolytes,
There
right?
you go. And also for some of our patients told me that they are now drinking little electrolytes in the water, right? They buy the electrolyte and they diffuse it with water. That's also would be a good way to get your water into intercellular space.
Are you feeling confident that your patients are going to all pull through this, or any, God forbid, in critical condition?
No, thank you. Thank you. I'm doing my meditation every day, sending them a lot of healing energies. All of them are recovering,
Oh,
for
thank God.
except for the one in Portugal that I mentioned that had the lady in Portugal was just recovering from lung cancer, and then she got it, I believe, at the hospital, and so we had to say goodbye to her the other day. Yeah, she passed. There is a gentleman in New York who is about 78 with severe diabetes. He's intubated and he doesn't look like he's doing well. And there's another gentleman who is also in New York. He's not intubated and he's recovering right now. And they allowed the family to give him a lot of supplements. They said at this point, even though it's an allopathic hospital, they usually don't allow that. This particular hospital allowed the family to bring to him high doses of vitamin C, high doses of vitamin D that he's taking. They brought him a compound with turmeric in it. He's taking turmeric, and he's taking, NAC and other things that we are doing in the
Can you
protocol.
just explain what NAC is? Because
Sure.
I think a lot of people don't know that.
Okay. NAC stands for N-acetylcysteine. N, and then dash acetylcysteine. So NAC, it's an amino acid. And it's a very powerful amino acid. This amino acid has been shown, not in COVID, but in other viruses in the past, to somehow prevent a higher level of the cytokine storm that I told you about. So when you think about cytokine storm, think about a lot of viruses rushing to the cell at the same time.
And how do you ingest NAC?
NAC is through a supplement.
So it's in like a capsule?
It's a capsule. You can also have in a powder form. You
And
can
what, how is it measured? In milligrams you take?
milligrams.
So what's recommended?
The research is showing 12 to 1800 milligrams a day. And so I'm using 1800s. We have a product in our clinic called methylation support that helps people with the vitamin B12 or vitamin 6 that they need with folate. And part of the protocol also has NAC. And so I'm telling people to take 3 of those pills a day so they get 1800.
And one more last question. Do you think that, people that have recently battled cancer or are recovering or have ever had cancer, are they particularly vulnerable?
Yes, yes. If you have had cancer in the past and you are out of the danger zone, if you're 5 year survival, your immune system is fine, you're not taking any immune suppressive medication, then no, your risk is a little increased, but not as much.
Okay.
Yeah, you're fine. So the research has shown those people who are not immune compromised. And since you disclosed that you're my patient, I can say to your audience, Fran's immune system is amazing. You're having a tremendous immune system. You're very strong. So no, your risk would be similar to the rest of the population. However, if you are if you haven't reached the 5 year survival in cancer therapy, in the cancer world, 5 years is a very important benchmark because it shows that if you have survived 5 years, the likelihood is that you're going to survive another 5, another 10, another 20. And so the 5 year benchmark is very important. If you are within the 5 years of having cancer, yes, you're still at high risk. If you have passed the 5-year benchmark, then your risk is similar to the rest of the population.
And do you feel like there's some connection between virus and cancer?
Yes, absolutely. I think we see that, right? We see that in regular medicine. We see that people who have, for instance, Burkitt's lymphoma, which is some kind of lymphoma, that people get, um, quite often that is associated with, Epstein-B virus. And so there's an association. So some chronic virus can indeed lead one predisposed to cancer.
Mm.
Not very common, but it's there. So those people with, increased viral loads of other viruses, they do need to be taking better precautions through strengthening the immune system.
Dr. de Mello, you are just an endless source of interesting information, and I'm so grateful to have you in my life personally, but also to support Cancer Schmanza in this way. We're hoping that our Corona Care for You series is well received, and people all over the world can use it as a resource, a very viewer-friendly opportunity while they're home to learn more about it and get some firsthand information from very experienced and wonderful doctors like yourself. So we really, really appreciate you. And I thank everybody at who are our viewers right now for coming and watching and sharing it with your friends and family. This is a time where, although we are isolated from each other, we're closer than ever, and exchanging information and knowing that it's not hopeless, you're not helpless. You can empower yourself through knowledge, and you can start to change your health right now, today, and support your immune system, because if you do that, your immune system will support you in times of crisis like this. So
Yeah, I
we
agree.
pray for you.
Yeah.
And would you like to say any closing remarks?
Yeah, I did. I would. I forgot to explain about physical distancing,
Oh,
the difference
yes.
between physical distancing and social distancing. We are social beings.
Yes.
Humans are people who wanna gather to celebrate birthdays, to celebrate life, to celebrate events. We go to parties, we go to clubs, we root for our teams together. And so asking people to be socially distant, I think it's not the way to describe, but that there's a better way to describe what we want for them. What I'm recommending to all of my patients, including your audience now, Fran, is for you to bet more than ever to be social via your connections. Connect with people. I received an invitation today to a dance party, a virtual dance party, where we're going to be dancing together with a group of doctors and nurses. We're going to be dancing
That's
together to be able
beautiful.
to decrease the stress of those of us in the front lines. So connect with your neighbors. When was the last time you wrote a letter? Not an email, but a letter. There's something very special about getting a letter. When was the last time you did that? Maybe there's a part of you that wants to write a story about your life. Maybe there's a part of you that wants to invite your neighbors to have a virtual dinner party where you guys come up with a menu and you eat together, everybody look in your screen and discussing whatever events you want to discuss with each other. Maybe it's about waving to your neighbor across the hall or crossing, the driveway. But it's very important right now, more than ever, to socially connect, because we know that this virus is forcing us to do it. It's a combined world. It's a global experience that we all have it. And somebody asked me just in another interview, and I want to end with that. They said to me, what is the one thing that you're recommending that all of your patients, including the 23 ones, now 22, that one passed away, what are you recommending that they do? And it didn't take me long to say, count your blessings, gratitude. sit down and say, okay, now that I have to do this, that there's a mandate that I need to be socially distancing and that I have to be at home, what can I do to really feel good about aspects of my life that I haven't paid attention to? Is it that I want to meditate more? Is that I want to perhaps watch a documentary that is very inspiring that I haven't watched? Is that I need to laugh more? We all know that laughing strengthens the immune system, so much so that that in India there the laughing clubs, and we know that when you laugh, when you have a good belly laughter, your endorphins are increased, and that's why we feel good. We feel very good after laughing. We all know that. So laugh more. But most of all, be grateful for what you have, not for what you don't have. So when I'm dealing with these people, my incredible patient, and they cannot breathe, and I'm walking them through my own way of calming them down, one of the things that I ask them is say, can you right now with me think about something outside COVID that you're grateful for, just right now? And let's be with that. And a small sample, 23 people, is very small compared to thousands of people infected, but I can tell you it works. When you sit back and you think about gratitude, when you think about the fact that I can sit on a chair in my house and have a computer to talk to you, that is gratitude. That I can be home, that my kids are healthy, that my patients are improving, then I feel inspired to keep on doing. If I think about the economy, what's going to happen in 3 or 4 weeks when the country reopens, I go down a spiral, and there's no place of return when you go down there. So, as I say goodbye with a lot of gratitude to you for having me on the show, I say, everybody, please practice gratitude out there. Find something that you're grateful for and expand that into your life.
I love that. And that's what I love most about you. You have a wonderful energy, and it's almost magical. And I'm a Buddhist, or as I like to call myself, a Buju. And so much of what you say is so much a part of the Buddhist philosophy. And, this is what helps us get through life and helps us support our body, because there's a consciousness to everything about us. And so if we allow ourselves to smile and to laugh and to count our blessings, that all actually physically helps our body function at an optimal. So great advice, beautiful distinction between social distancing and physical distancing. So keep social, but be physically distant. And God bless everybody, and especially you, Dr. De Mello. Thank you so much for joining us today at Corona Care for You, sponsored by Cancer Schmancer. Hi, everyone. It's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You. And if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events. So it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.